Ananya Sharma. The WHO released a statement today where they have said that the global risk of the spread of COVID-19 virus is very high. How many more such levels does the virus have to cross to be declared a pandemic? First of all, let's define terms here. Epidemic means an outbreak of a virus in a specific region that is losing control. Pandemic is worldwide, meaning it's happening in multiple countries and it spreads easily. This very high level is the highest level they have. I believe it's from stage 1 to 4. And the very high classification is stage 4. So essentially, we might as well function as if this coronavirus outbreak is a pandemic. Because in reality, it's in so many countries, it's being spread, it's going to continue to spread, so we might as well call it what it is, a pandemic. Emma Plazas, is there anything you can take to boost your immune system that actually works? Emma, I'm so glad you asked this question. I see countless ads on Instagram, on the internet, of people trying to peddle some sort of supplement that's gonna boost your immune system and protect you from this virus. That is absolute poo-poo. There is no such thing as an immune boosting supplement. Look, if you wanna keep your immune system healthy, get vaccinated, get 7 to 9 hours of sleep consistently every single night, eat healthy, exercise, follow proper hygiene, and that's the best thing you can do for your immune system. Ignore people trying to make a buck in this situation. In fact, those who are doing so should be ashamed of themselves. Big Smoke, as a doctor yourself, are you worried on what's going to become of the COVID-19 virus? I'm not gonna say I'm worried. I'm gonna say I'm thinking about the worst possible scenarios and trying to get prepared for it. In fact, that's what every major hospital institution in the United States is doing as well. And we're doing a good job at that. We're refreshing our personal protection equipment policies. We're learning what questions to ask patients. What is the ideal route for a patient to come into the office to get properly tested? Where should they be in isolation? We need to make sure we get all that information wrapped up. Every healthcare provider is aware of that so we can give the best possible treatment to our patients. Colton Schwartz, are people in the US at the possibility of it spreading like it is in China? The possibility certainly is there. In fact, my recent television appearances, the anchors have been asking me the same question. What's the deal with community spread? Because there was a single case in California where we had an individual who tested positive for the coronavirus without exposure to someone from an area where the coronavirus is present or someone actively sick. In those situations, we label that community spread. In this situation, research is still ongoing to figure out how that person was sick, so we're not labeling it community spread just yet. We're suspecting that it's community spread. I'll give you an example. If a patient comes into my office with the influenza virus and I diagnose them with the influenza virus, I don't go and do an investigation of how they got it. I just say, hey, you got it from the community, so we label it community spread. If community spread starts happening, meaning that there's patients that are coughing and sneezing, walking around, and they're not being quarantined and put into isolation properly, that can cause a huge uptick in cases. Something else that could be going on, which we're just learning about, is that there's some patients that are having asymptomatic spread of this virus, meaning that they're not showing symptoms. The virus is in an incubation stage, which we're saying lasts anywhere from 2 to 14 days, huge range, at which time where they can possibly spread the virus but not show any symptoms. That could be problematic on one hand, but also positive on another, meaning that there's a lot of cases we haven't diagnosed yet, which will lower the lethality rate of the virus, making it less dangerous. So we have to figure it out, we have to wait, and we have to not rush to look at numbers every single day. Those numbers will change, those numbers will grow one day, shrink another. Let's look at averages, let's look at guidance from trustworthy sources like the CDC and WHO and go from there.